We're going to start with the structures of the kidney. And right off the bat, we've got this outermost layer of the kidney, which is called the fibrous capsule. Now, if we look up here, this is the kidney. This red line is going to be that fibrous capsule. We've got perinephric fat touching the kidney, renal fascia separating the perinephric fat from the paranephric fat. We've got the renal cortex, which is kind of this outer inner part of the kidney right here. And then we've got ourselves the renal medulla, which is just the most inner part throughout here. The inner medulla is going to have medullary pyramids, which are these pink triangles here. It's going to have papilla. Papilla are the very end of these pyramids. And they basically separate the medullary pyramid from this minor calyx, but we'll get to that in a sec. Then we've got renal columns, and renal columns are just in between the pyramids right here. Minor calyx, like I mentioned before, are these little collecting bits right here, and the papilla separate the pyramid from this minor calyx. So papilla would be here, this is the minor calyx. Now, over here we've got some minor calyxes as well, and when they converge right here, we've got ourselves a major calyx. And when everything converges, we've got a renal pelvis, which is this region right here. And from the renal pelvis, it goes into your ureter. The renal hilus is just an area where all the vessels will come into the kidney. We're going to do the blood supply really quick as well. And the way it works is you got this renal artery, which branches off into the segmental artery. From the segmental artery, it's going to go into the interlobar arteries, to the arcuate artery, which is right here, which goes around, kind of arches on top. Then you've got interlobular arteries, which are the tiny little dudes at the very end. Now, basically what we can do is we can just go back the other way from veins. We've got ourselves interlobular veins, arcuate veins. From the arcuate veins, it's going to go down into the interlobar vein, which is right here. The interlobar vein is going to go down into the renal vein, which is down right here. There is not a segmental vein. Just keep that in mind. And specialized vessels, basically what we've got is we've got afferent vessels, which are going to be taking blood supply and different things into the glomerulus, which is this funny looking dude right here. Then you've got efferent arterioles, which take it away. So afferent goes to, efferent goes away. Once again, this is the glomerulus right here. This is the Bowman's capsule. And the entire thing is called the renal corpuscle. But the renal corpuscle consists of the glomerulus and the Bowman's capsule. If we look here on this model, we can see two different types of capillary beds. We've got ourselves the peritubular capillaries, which are up here around the glomerulus in the proximal convoluted tubules. Then we've got the vasa recta, which is down the nephron loop, and we'll get to that in just a sec. But once again, vasa recta is on the loop, peritubular capillaries are with the tubules. Then, page. Once again, this entire thing is a renal corpuscle, and we can see that as these kind of red dots here. The entire thing is renal corpuscle, glomerulus, Bowman's capsule. We've got the proximal convoluted tubules. And if we look here, this is the glomerulus, Bowman's capsule, renal corpuscle, right? Zoom out a little bit, this is the renal corpuscle here. Now, this yellow bit is the proximal convoluted tubules, and it comes out of the Bowman's capsule, or the renal corpuscle here. Comes out, all this yellow, and it goes down to the nephron loop. Nephron loop consists of the thick descending, the thin descending, thin ascending, and thick ascending. And then it goes into this right here, which is called the distal convoluted tubules. The distal convoluted tubule is going to go all the way around, go into a collecting tubule, then it goes into the collecting duct. And the collecting duct is going to take it down to the minor calyx. Then let's see. Once again, minor calyx is here, and it's going to go out to the ureters, which consists of this over here, this kind of yellowish tube, right? This is the ureter, and it's going to go all the way down into this bad boy, which is the urinary bladder. Now, the urinary bladder, if you were to look on the inside, has got detrusor muscle right here, and if I can, there we go, that's better. Detrusor muscle is all this, and this little triangle right here is a trigon, and then it's going to go down to your urethra. You can't see these two on this model, but your internal urethral sphincter is going to be here, your external urethral sphincter is down here. Your internal is involuntary, while your external is voluntary. And with that being said, that is the structures of the kidney.